Hi, this is Dr. Duresti with the Cranial Release Technique. Back in the car, back in Florida. It's a beautiful day, about 80 degrees and blue skies. Happy to see everyone again. I was thinking the other day about the concept of is less best. And what I mean by that is I can remember coming right out of chiropractic school as myself and most of my colleagues, and we would, do certain things with patients and do quite a few things with patients, especially in the beginning. And in my experience, as time has gone on and we've become more experienced as chiropractors or massage therapists or acupuncturists or physical therapists or practitioners from all different holistic disciplines, in my experience and from speaking to many different practitioners, the tendency is what we do today, 20, 30, 40 years down the line after graduation, tends to be a lot less than what we did way back when we first got out of school. And with experience comes expertise and knowing that maybe you don't have to do all the different things that you thought when you first got out of school. And of course, that brings me to the cranial release technique, which is probably the ultimate less is best. Taking all of about a minute to do, addressing the cranium, the 22 bones of the cranium, addressing the primary respiratory mechanism of the cranium, enhancing that primary respiratory mechanism of the cranium, and allowing the brain and central nervous system to function optimally. And that's all there is to the cranial release technique. After you perform that with the patient, which takes about a minute, like I said, then of course you could go in and make the adjustment or put in the needle or do the massage or do the ralphing or the myofascial release or the reflexology or the auricular therapy or whatever it is that you're into. So the 1 minute cranial release technique to me sort of sets the table, and in my practice, the way I practiced for many years, and the way if I were going to work on you today would be, you're going to lay on the table, I'm going to work on you, it's going to take about a minute, and then I'm done. And then I'm going to let your body go through the things that it needs to go through. We restored the primary respiratory mechanism. I'm going to see you back in a few days or in a week, and we're going to do it again, and we're going to keep enhancing the primary respiratory mechanism and let the body's own internal forces come back, strengthen, heal, balance the body, and we'll see where we go from there. And then maybe you do need an adjustment after that, or a myofascial therapy, or acupuncture, or whatever therapy that you as a practitioner or you as a patient like to receive. That's great. But don't leave out, to me, the most important part, which is the cranium. Cranialrelease.com is the website. I'm happy to announce now the online training program, which is, again, on the website. Just click online training program to learn everything you need to know in the comfort of your home or office. There's now a new payment schedule where the payments are now broken up into 4 interest-free payments to make it easier for people. So go take a look at that. Cranialrelease.com. This is Dr. Duresti saying adios, my friends. Spring is here in beautiful Florida. I hope it's springtime where you are in the northern hemisphere. And I know the beginning of fall south of the border. So south of the equator. Sorry about that. Be well, everyone. Talk to you soon. Adios. Cranialrelease.com. Goodbye.